studios in New York City. This is Charlie Rose.
Sigmund Freud was born on May 6, 1856 in Freiburg, then part of Austria-Hungary. He died in London on September 23, 1939. On his death, the great British poet W.H. Auden wrote, "To us, he is no more a person now, but a whole climate of opinion." He meant that Freud conceived of psychoanalysis as a new way of thinking about the human mind and human behavior. For Freud, psychoanalysis had two components, a new theory of mind and a new therapy for mental illness. The psychoanalytic theory of mind has been particularly influential and has touched almost every aspect of our lives. In 2006, we celebrated 150th year of Freud's birth. We can now look back with the perspective of time and see whether Freud still represents a whole climate of opinion. We can ask, how has psychoanalytic theory held up? How has it changed? How has psychoanalytic theory evolved? Joining me now are four men who have pioneered these new directions. Aaron Beck is a professor emeritus at the Department of Psychiatry at the University of Pennsylvania. Beck's research led to his creation of cognitive therapy, for which he received the prestigious 2006 Lasker Award. Peter Fonagy is the Freud Memorial Professor of Psychoanalysis at University College London. Stephen Roos is Professor of Clinical Psychiatry at the College of Physicians and Surgeons at Columbia University. Also here, a friend of this broadcast, Eric Kendall. He's a psychiatrist and neuroscientist and Professor of Biochemistry and Biophysics at Columbia University. In the year 2000, he won the Nobel Prize in Physiology of Medicine. I am pleased to have all of them here to talk about Sigmund Freud and what has followed him and his inquiry into the mind, a subject that intrigues me not quite as much as it intrigues them. I haven't devoted my life to it. I don't know where I should start, and maybe, Peter, we go with you. Tell me what has been the impact on the intellectual and cultural understanding of Freud in the contribution to, in the beginning of our looking at what goes on in the mind.
But Freud followed something that actually was going on in the 19th century anyway, a recognition that the conscious mind saw what was the product of the workings of the brain rather than everything that was in the brain. So it's a bit of a shock to Western civilization when discovered that actually what we are conscious of is actually just a very small proportion of what goes on in our minds. And it was a bit of what you could call an injury to human self-esteem, that really consciousness didn't have that overarching quality of control that we attribute to it, but much that happens in the brain we are actually not aware of. The beliefs, the wishes, the desires, the mental states that we have are actually, a lot of them happen outside of awareness. The decisions that we make occur without us having conscious control of them. If you are hypnotized, for example, as anyone who's seen a stage hypnotist would be able to confirm, you do things and you're not aware of the reasons why you do them. Freud has put this particular piece of insight into the public domain, and I think really changed our view, how we regard ourselves and how we regard others.
Eric, you studied Freudian psychiatry. In fact, you're from Austria.
That automatically qualifies me.
But there's been an evolution in how you have spent your professional life.
Yes.
But take me back to Freud. What was it about him and his teachings that intrigued you?
Well, I think what I found so interesting about Freud is, as Peter pointed out, he emphasized the importance of unconscious processes. But in a larger sense, he gave us a much broader and more nuanced view of the mind that we had before. Simply to put it into context, people that were contemporary with him were people like Pavlov, the behaviorist Thorndike, Slater Skinner, who looked at behavior as an input-output relationship. You expose the animal to a stimulus and you look at the response and you describe in very quantitative terms what you do and what the animal does without any concern of what goes on in between. The desires, the motivations, the wishes, the expectations that occur in human mental processes, and Freud identified all of these. Moreover, he put this in the context of trying to understand how various forms of mental illnesses occur. He spoke of the fact that there were mechanisms of defense, like repression, that forced certain instinctual desires back out of consciousness. And he had ideas that psychopathology came from this repressive influence. So he really gave us a coherent view of the human mind that we never had before. The challenge was to take this very broad theory and to try to put it on an empirical basis, to try to see, can we get independent evidence for these ideas? Can we get independent evidence for the mechanisms whereby therapy works? And I think the work of these three pioneers in the field is to try to place Freud's broad schema on a more solid empirical scientific basis.
Because I have heard people say, you know, they didn't buy Freud because you couldn't prove Freud.
I think that you have to look at the origins of Freud as really having created two things. One was a metapsychology, an understanding of the brain, organized thinking, as Eric has referred to, the functions of the mind. The other was he began a treatment. He began a whole industry of a particular form of psychological treatment, of using that model of the mind, the psychodynamic model of the mind, in the earliest cases of hysteria, to release and abreact strangulated affects, to release people from those repressed memories that were affecting their functioning. And one of the things that Dr. Beck has certainly done, and others have tried to think about the therapy that's evolved, and how do we systematically, scientifically study the therapies to see, can we put them on an empirically validated basis? It's not just enough to look at the writings of Freud, but one has to also begin to study the psychoanalytic and psychodynamic therapies.
Can you consider him to be the father of psychoanalysis?
Oh, absolutely.
Absolutely.
He formulated all the psychoanalysis.
So that's clear.
I think one interesting thing that one interesting thing that puts, I think, the current situation into a framework is that Freud began as a biologist. Right. He was an extremely good biologist. He made contributions to how nerve cells function, how they communicate with each other, and he gave this up in order to devote himself to psychoanalysis for two reasons. One is he felt that biology wasn't mature enough to explain higher cognitive processes. And also, in order to have an independent scientific career in those days, you had to have an independent income, and he didn't have that, so he had to go into private practice. So I think there are two issues. One is, what aspect of psychotherapy works and how does it work? And I think Aaron Beck pioneered that approach, and Peter has continued this in psychoanalysis. And the other is, what is the biological basis for all of these? These are really two separate issues. One is efficacy. Does it work, and why does it work? And the other is, what is the biological underpinning?
What did Freud tell us about how the human mind works, and what model?
Well, the model that he had, as it's already been described, was that there's an unconscious mind. Right. And this unconscious is just filled with all kinds of nasty impulses. And if these nasty impulses came out into your conscious mind, you'd feel really bad. Or if you acted them out, you'd feel even worse. And so individuals developed what was called repression. This is a whole layer to cut down on the nasty impulses that were there. So I wanted to do some research to determine just what these hostile, sexual, bad things were, and to try to prove that Freud was right. So I decided that I would look at depression. Now, Freud and some of the other people felt that depression was due to hostility that people experienced, but ran up against this wall of repression and then got deflected downwards. Went into the unconscious. Now, it was believed at that time that the dreams were the royal road to the unconscious. Right. So I thought, why not just look at the dreams, and we'll be able to pick up all of this hostility, and then we'll prove for the first time that Freud was right, using the techniques of modern psychology and modern science. Unfortunately, when I studied the dreams of depressed patients and compared them with non-depressed patients, depressed patients showed less hostility. my analyst
What did that tell you?
Well, it told me that either I didn't go deep enough, or the experiment was a failure.
Well, okay.
But it was an experiment.
It was an experiment. But I did notice something very interesting, and that is that in the dreams of the depressed patients, the scenario consisted of the patient being thwarted, deprived, diseased, deprecated, disparaged, and so on. In other words, the dreams portrayed the dreamer as a loser, as some type.
Right.
Well, when I asked the patients about the dreams, it turned out that this is the way these depressed patients saw themselves in their real life. And I thought, well, maybe I didn't get deep down into the unconscious, but I got something I could get a hold of. And so when I started to talk to these patients about all of their negative beliefs about themselves, it turned out these negative beliefs were exaggerated or totally wrong.
Yeah.
And what I then called cognitive therapy consisted of getting them to evaluate whether a particular interpretation of a situation was correct, and to actually apply scientific principles, set up a hypothesis, I am no good, everything I do is wrong, look for the evidence, look for the counter-evidence, look for specific incidents, and then do some kind of a behavioral experiment and see how it turned out.
Now, what's a behavioral experiment?
Now, behavioral, to give you an example, there was a woman I saw many years ago, actually, who became depressed after a breakup in a relationship. And her conclusion from that were two things. One is that she was totally unlovable, and secondly, that she could not maintain a relationship, and therefore, since she could not live without a man, she was going to be consigned to being unhappy for the rest of her life. So first I had to look at the question of being unlovable. I said, okay, what's your evidence for that? She said, well, I've had 3 relationships and each one broke up, and that proved that she was unlovable. I said, well, what's the other evidence? Are there any other people in your life? And she says, oh, yeah, I got a lot of friends, and they all love me.
Relationships, yeah.
And these other people do love her, and so on. So anyhow, that made a little chink in there. But the big problem was her belief, I cannot live without a man. And so I asked her, I said, was there any period of your life when you were really happy, and right now you're very unhappy? She said, well, when I was in graduate school, I was really quite happy. And I said, and who was the man you were with then? She said, you know, I didn't have a man then. So I said, you know, that's kind of odd. If you can't live without a man, how did you survive then? So that, that made a little change. And so then the behavioral experiment was, I said, obviously what happened in her relationship is she was so anxious about being abandoned that she would cling to her partners, and she was always asking for reassurance. And eventually she would drive them crazy, and they'd leave. So I said, well, you know, you've got to work through a few things. So how about if you do this experiment and let's just talk about things and don't try to start up a relationship for a period of time. And when she went for a period of time without a relationship, she was much happier. And then I said, well, now that you feel you don't need love, perhaps you can go out and get love. And at this point, since she wasn't so desperate about getting love, she was able to get another relationship. And she got happy, but she wasn't desperate anymore.
Now, so explain that. What we learned from that, what he just told me is?
Well, what he discovered is the fact that people have behavior patterns that are pre-conscious or even consciously aware of that leads to their being miserable. It doesn't involve deep insights into the unconscious, just looking at the person's thought processes. And he realized that people who are depressed have a certain kind of logic to them, and if one points out to them that this logic bears no relationship to reality, it helps them realize it and change their behavioral patterns. So both of these people have made an independent, remarkable insight that you can improve behavior without deep insight into unconscious processes by just paying attention to style of thinking and styles of behaving. It's a radical shift in the therapeutic approach.
Now, see, this just seemed fundamental to me. I mean, you
Very
sit down
fundamental.
and it's basic.
He's made several absolutely fundamental contributions. He's very modest. It hasn't emerged yet, but it's all there.
He's being very modest.
I'm being modest.
Well, there's so much to be modest about.
No, we want you to stop being modest. All right, you want to say?
Yes.
I mean, I think the interesting thing about the story is, of course, how did she come like that? What happened to her in her early relationship, particularly in her early relationship, perhaps with an important attachment figure, maybe her father, maybe her mother, that made her so convinced that she couldn't possibly be happy unless she clung on to the person that she was with, that she seems like she's constantly afraid of losing the person, that if she's not careful, the person will slip away. So she's holding on to them for dear life. And until Dr. Beck is able to teach her that actually you don't really have to do that. You can feel more in control, let go slightly, and she's able to let go. But actually, one part of our interest is really not so much how therapeutically you can make use of that knowledge, but in thinking about the patient, how you can understand the pattern better if you think about the early relationship that a child has with their attachment figure, with their caregiver. So what I'd be curious about, in the case of your patient, is what you discovered about the early relationship that your patient had.
This was her history. She had a very anxious mother, and she had a father who was in and out of the house. And the mother herself was always clinging to the father when he came home. And the little girl would go off in a corner and cry whenever the father was away. And so it was very clear to her that she was just repeating this pattern that she had with her parents. The interesting thing, though, is she had been to other therapists who had gone through this past history, and nothing of it changed. So it was very important for me as a therapist to know the past history, but then to utilize that knowledge to help her in the here and now. Because it's what's happening right now is what really matters, not something that happened 30 years ago.
But to understand what happened 30 years ago
is very important to help her with the present.
We can add another perspective to this, which goes back to Eric's work, which is there you have her as a child going through certain repetitive experiences with an anxious mother, repetitive losses, and how that impacts her developing brain, how that becomes encoded in her brain structures and in her responses, so that, in fact, it can live on independently after she leaves that atmosphere. That, again, we get into how our patterns or behavior become a kind of embedded and encoded in our brain structures, which then independently perpetuate that. I would just say one thing when you said about that now that she doesn't have a love relationship, she can go out to get one. Well, she had a very important relationship during this time, and that was the relationship with you. Which had a very profound impact on her, and has something to do with, it's not just the therapy is done, but who's doing the therapy that has a major impact.
Something like reparenting, I suppose.
or trust. Trust,
which is
trust.
an essential part of it.
There's another interesting idea that really comes out of this discussion, and that is, what is Freud's contribution? Freud emphasized very much that early childhood experiences have long-lasting consequences on later psychological functioning, and that often a neurotic disturbance can be traced back to difficult traumatic experiences in childhood. And in various ways, we are seeing that aspects of that have persisted. So Freud said that mental illness is due to two things: a genetic predisposition and patterns of child rearing. Disordered pattern of child rearing. And both of these people have made, and you might speak to attachment theory and things like this, brought this to a new level of understanding, made it much more experimental.
Let me just understand part of what you just said. It is that people still can look at the work of Freud and bring it into a broader and more usable.
Yes, exactly. I mean, my view of Freud is that there is no question he made a number of mistakes. But every scientist, certainly someone that didn't have any empirical evidence, is going to make mistakes. What the subsequent generations of psychoanalysts have to do is to begin to tease out what of this has validity and what does not. And that's just beginning to happen. For many years, scientists were not experimental at all. They didn't do any investigative work on the reliability of these phenomena.
You say one interesting thing which we mentioned here, and this is in terms of the principles of Freud.
Yeah.
Is it when results were very, very successful, as you had with the woman in question, is it more because what everybody wants to do is obviously get someone to reveal themselves, and so with the appropriate academic training, you can understand cause and effect.
Right.
All right. And what the skill here is how you were able to get that person to take that journey with you? Or am I making this too simple?
No, you're not making it simple, but I think the new twist that they introduced is that the journey need not necessarily go back into deep unconscious processes, but just looking at the lifestyle that is going on here and now reveals an enormous amount about what's bothering them, and directing your therapeutic attention to that itself can be beneficial.
Okay, but what does that have? Is it by being beneficial also in no ways being dismissive of going back?
No.
That's all right.
But there's no doubt that the present is caused by the past. Nobody would disagree with that.
Right.
The question is whether you're going to intervene therapeutically. Do you have to go back to that past to, as it were, recapitulate the journey? Or do you meet the person head-on as they are with you today? And Dr. Beck has made an enormous contribution. This
is called cognitive therapy?
Yeah, that's right.
Yes. Enormous contribution is to show how human consciousness, when it addresses itself to a particular pattern, to a particular problem, could actually be self-corrective, could actually make a powerful difference to the way the person is. And I think that is really just part of Freud's insight. Freud had said something that was very telling. He said, where it was, there shall ego be. By that he meant where the unconscious was, there will consciousness be. Yeah. And I think what actually Dr. Beck's contribution builds on is that remarkable insight that human consciousness, when it addresses itself to a problem, can cause wonderful changes. It's a miracle. To me, it's miraculous.
Right. Are we finding out in looking at neurons and all the other stuff that you examine in the lab, are we finding out that what Freud thought about things was simply wrong, that the biological underpinnings that we now understand suggest that he was wrong?
I think there's some areas in which he was just way off.
Well, like what?
Female psychology. He really didn't understand the female sexuality to any deep degree, and thought that they were the mirror image. What they lacked was a penis. And a lot of their
penis envy and all that.
Right. So I think we all agree that that's just it's completely wrong. But in terms of the kinds of issues we're discussing here and what Beck and Fonagy have done is Freud placed a lot of emphasis on the repression of early memories, as if kids had an actual memory of a traumatic event, seeing their parents making love together or something like that, found that unacceptable that somebody else was touching the mother, and therefore repressed it.
And therefore repressed it, and therefore the conduct they exhibited later was a result of that repression.
We now know that kids at that early age really don't form concrete, explicit memories that they're conscious of. What they remember is behavior patterns.
How do we know that?
Because we see that they don't have this capability. At early age, the areas of the brain that are involved in that kind of memory formation are not mature enough to give rise to that. They primarily work on behavior patterns that are implicit. As Fonagy said before, Freud realized that a lot of behavior is unconscious, including behavior patterns, and kids show a lot of these behavior patterns, and what they repress are things related to that. So his idea of what actually kids remember from early childhood was erroneous. The biological evidence now supports that.
I think there's another point. Freud believed in the blank screen. That is, the analyst should be passive and just be like a screen. And the patient would then have all the recovered memories from childhood or all the imaginations, and they would be projected on the screen. Nowadays, we feel that that is counterproductive, that the analyst or therapist has to be a human being. And that much of the mileage that we get out of therapy actually is the relationship, as we discussed.
Right, exactly what I was raising. Trust.
And so, number one change is working in the present. which we mentioned before. The second is having a very good relationship. And the third is teaching the patient how to cope with situations. Look at things like problem solving rather than just getting insight and understanding, but giving the patient the tools by which he can conduct his life in a more normal and rational way.
You seem like the most practical people I've ever met. You.
Right. Well, I think that I've been called a pragmatist, so...
But it is, in a sense, you're saying...
Yeah, it's a hands-on, let's do it and let's get through it and get over with it.
Let's see if we can work this out.
Yeah.
But it's Aaron Beck's practicality that really put his kind of psychotherapy on an even higher level than we've discussed so far. Because once he got the sense that it worked, he began to standardize it. He wrote a cookbook, if you will, so that Charlie Rose and Eric Kandel, if we wanted to do it, could practice cognitive behavioral therapy.
Right.
And the third thing is, and this had been unheard of before, he did outcome studies. He showed that this works compared to placebo, compared to drugs. So the first systematic studies of whether or not therapy works is what Aaron Beck attributed.
What is the biggest misconception about Freud, you think, in terms of common parlance?
The biggest misconception, I think that he was all about sex.
That's it.
I think there's another thing, I think, is psychic determinism. We believe that all of your emotions and behavior were determined by unconscious processes, and that the conscious mind was either a rationalization or some twisting.
But wait a minute, I want to make sure the question is understood. I said, what do we assume about him that's wrong, not so much what he assumed that was wrong. Do you understand?
I think one of the things that we assumed about him was wrong was that his style of therapy was a non-interactive and very austere and removed. He would have been considered not Freudian at all in our current parlance. He was very active. He was very involved. He was an investigator in that consultation room. And I think it's some subsequent generations which have made a caricature of this silent, uninvolved, austere analyst.
Do you think,
he
for
used
example,
behavioral experiments, for example, just of the kind that Dr. Beck described?
Do you think that he would have? I mean, that he would be open to all of the scientific developments that have been?
He said repeatedly, everything I'm saying is going to be replaced by biology.
He said that?
He absolutely said that. He said we're at a very primitive stage in the field. I'm making up all these elaborate ideas. There's going to be a science that comes along that's going to tell us which is right, what's wrong.
Okay, what is that science? No, let me precede that by the following.
You're going to get 4 different views.
You know enough not to wait for the answer to that, right?
Did you go into Harry Grunfeld's lab and say to him, I'm here to find the id and the ego and the superego, and I'm going to go here and spend 6 months and find it?
I was a boob. I didn't know what the hell I was talking about. I was lucky he didn't kick me out of his office, for God's sake. Because this is what I wanted to do. This is something we are beginning to be in a position to do now. But certainly when I asked him in 1955, that was ridiculous. Absolutely ridiculous.
Why did you ask him?
Because I came from an analytic tradition, and these were the interesting questions. And not only that, but that was a particular time when Penfield, the neurosurgeon, was beginning to operate on people who had seizures of various kinds as a result of scars in the brain. In order to make sure he didn't remove language areas, he would stimulate the surface of the brain in patients who were not anesthetized, and they would respond. And you get interesting responses. So it dawned on me, because people have described this in the literature, that soon neurobiology would reveal all of the psychological processes that Freud was talking about. The id, the ego, and the superego.
And were you right?
No. We're beginning to get to the point where we will, over the next 100 years, be able to address that. Some of them we've already addressed. Most of them we
will eventually be able to address.
We will eventually be
Okay, I want to come to the point. You said everybody has a different idea of what is a science, but we'll be able to do that by what? By imaging, by...
Yes, by combination of imaging, work with experimental animals. Lots of things that humans do, you can study in monkeys and in mice and even in snails. For example, fear responses or learning responses or different kinds of memory. You can study in experimental animals. You can see which regions of the brain are involved. And then you can test using imaging, how these areas function in the human brain. Just a simple case that we can talk about here is Aaron Beck has worked out a form of therapy, cognitive behavioral therapy. Work on learning and memory indicates that memory involves structural alterations in the brain. Okay, so insofar as psychotherapy works, it's producing a permanent change in behavior. That should be reflected by structural change that you should be able to image. So insofar as you walk out of this discussion with the four of us, a different person than you walked into, we should be able to detect that.
In my brain,
by
looking at my brain.
Absolutely. You know, now, a subtle thing like we're talking about is probably impractical now, but in his case, people have shown that if you use cognitive behavioral therapy on patients with obsessive-compulsive neurosis, there is an abnormality in the caudate nucleus in those patients before therapy. If the therapy works, and only if the therapy works, that abnormality disappears.
And you can see it disappear.
And you can see it in front of your eyes. And not only that, that abnormality also reverses with a Prozac-like compound, a selective serotonin uptake inhibitor, psychopharmacological agent, and that produces a similar change. It also reverses its abnormality. Now, in this case, psychopharmacology and psychotherapy produce similar changes, but perfectly conceivable to me that you can have a good behavioral outcome by producing different changes. You can have a counterbalancing force coming in rather than just removing it.
And there were studies which actually show, looking at psychotherapy, such as cognitive behavioral interpersonal psychotherapy in depression, that there are different areas of the brain that change than when you use medication. You may get the same symptomatic outcome, but the psychotherapies work more, let's say, top-down, cortical down, where the medications work at different levels of the brain, which, you know, again, bring up the issue of, rather than the traditional antagonism between these treatments, the fact of combining different treatments, medication and psychotherapies. I don't think we refer to them as biological or psychological treatments anymore, but they're all biological.
Exactly.
They simply access the brain in different ways. And you can imagine that accessing the brain in these areas in multiple ways may have a synergistic beneficial effect. And I think we've seen that in patients.
I'm sorry.
Yeah, no, but I mean, given that the brain is the organ of the mind, how could it be otherwise?
Exactly.
It couldn't really be otherwise. It'd be very strange if the cognitive behavior fed back into the spirit.
Right, we couldn't see it.
You know, there's another aspect to this, and that is some patients respond better to psychotherapy and some respond better to pharmacotherapy. So if you combine the two, you throw out a bigger net, and you can get the psychotherapy responders and the pharmacotherapy responders in the same net.
Okay, but is that what's happening in this broad profession that you both are involved in, understanding the brain and the mind and the conscious and everything else? Is that there is a marrying now, and so one learns from the other.
There is a new synthesis occurring that has brought psychoanalytic, psychotherapeutic thought in the context of biology. And the hope is a unified language would emerge whereby the model of the mind would come from these people and the biological understanding of it would come from the neuroscience community.
So wait, these people would give us the model of the mind.
What are the kinds of things we have to explain? You see, many people think that when neurobiology comes along, it's going to wipe out all of this stuff. And that's not at all the way we think. I mean, what insights we have gotten now in the biology of higher mental processes is that we've used what cognitive psychology and what psychoanalysis has taught us about the functioning of the human mind and looked for the biological underpinnings of that. And that has been an extremely successful marriage. There's no way you can, from a bottom-up approach, that is a molecular biological approach to the brain, explain these processes if you didn't understand, if you didn't have at least an outline of what needs to be explained.
Which they give us.
They give us.
Understanding what needs to be explained. Or an awareness of what needs to be explained.
Exactly.
And what you can't
I'm
see.
slow, but I'm getting it.
You're getting it. A little bit more therapy and you'll be there.
and a few more drugs and I'm there.
You can see the brain changes.
Yes, he's imaging over here. Go ahead.
But you see, what maybe as you're treating a patient or as you're dealing with somebody with psychological, what you can't see so clearly is the different kind of processes that act together, that come to work together to produce that final outcome. Whatever it is, that behavior pattern or that problem or indeed that adaptation, that positive thing. What this marriage that Eric is talking about with neuroscience will give us is a way of understanding how these processes act together to produce an outcome. And what that will give us ultimately are more effective therapies that go in specifically addressing particular psychological processes that we can address in a psychosocial way. Now, that is still in the future. I can't see that yet.
No, but he's absolutely pointing that they're bound to be different therapies that evolve, and we need to know which are useful in which indication. And things like imaging and other ways of evaluating the brain would help us. That, for example, under what circumstances is a female therapist more effective than a male therapist? You know, with a young woman, with an adolescent boy, I haven't the foggiest notion. These people can probably give you answers to that. But there are obviously going to be differences in the kinds of therapists that are most effective with certain patients. And having an independent, objective way of evaluating that is going to be extremely useful. And that comes from two things: outcome studies, which doesn't require imaging at all, but ideally outcome studies in combination with imaging, so you can get insight of what's happening in the brain.
Yeah, most you obviously all are, but is most of the profession open to this marriage and these ideas?
No.
No.
Well, yes.
Wait.
No.
Why no first?
I think it's evolving. I think that while psychoanalysis was at its heyday in the United States in the 1950s and 1960s, and there are descendants of that tradition still active now, the feeling was that we don't really need biological insights into what we're doing. We really understand things pretty well. That is disappearing, and the younger generation, of which we're seeing in Beck a perfect example.
Young fellow, we're proud of you.
These are more progressive thinkers.
Yeah. But there are still people who don't want to. I don't want to hear it. I know we're doing it right. I know I've been able to access the behavioral difficulties of people.
I'm not sure that. I think there are two things that are happening. First of all, I think there was a period of time where actually traditional psychoanalysis thought that not simply that they didn't need biological investigation, but they were hostile to it.
Right.
Because it was really a reductionist simplification of something which was really
too rich,
and it was dumbing things down, and it was really doing injury to the concepts.
That's absolutely
in the same way that the use of medication, antidepressant medication, was considered to be an anathema to treatment because you were interfered with treatment. You were just putting a Band-Aid on things and depriving people of motivation. I think that, by and large, that's changed. We know actually now that about 40% of people, 30 to 40% of people who are in analysis, traditional analysis, 3 or 4 times a week on the couch, are also on antidepressant medication. There's a much more pragmatic, fortunately, approach to the fact that you need to treat depressive illness in order to allow certain people to be amenable to therapy, to be able to work in a therapeutic situation. I would also say the issue in terms of the neuroscience is that I think the psychoanalytic community is, in a certain way, understanding that we can be enhanced by a understanding of brain mechanisms and of the mind. There is, however, still, I think, a cultural threat. Psychoanalysts, there's part of the psychoanalytic community that's worried that, well, maybe if we really study our treatments, we won't find out that they're as effective. Maybe if we really understand some of the biological underpinnings of the mind, certain of the metapsychology, certain of the beliefs that we hold will turn out to be incompatible with the sciences we know, as you were talking about in terms of early memories. So I don't think, I think psychoanalysis is a field in transition.
Yeah.
Well, people who think that need analysis to understand why they have that fear.
I agree with you. I completely agree with you. I completely agree with
absolutely.
you.
Right. Why is it you're fearful of science? Why are you fearful of science?
Right. And that's the, I think that is exactly right. That's what the analytic community has to confront in itself.
There's another aspect of it, and that's sort of a pedagogical point of view. Analysts are Talmudists. They love
Talmudists?
Yes, they love to read and talk and discuss issues. So they want to learn about neuroscience. They have a couple of people in several times a month to talk to them about it. And they think they become neuroscientists as a result of it. They don't realize that this is a full-time occupation. You know, I had a discussion with a very distinguished analyst several days ago, and I was disagreeing with him, saying, you know, he didn't have any controls for the statement. He said, well, look, it's not that I don't know anything about science. I did neurophysiology for 2 years, and I told him I was an analyst for a number of years. Doesn't make me a psychoanalyst. In order to really to do science, you've got to roll up your sleeves and do the work. And they're not trained to do that. They're really trained to be practicing psychoanalysts.
But
so we need to bring along a new cadre of people.
That's
A
the point.
new cadre of people.
we need to bring along. Are we bringing along a new cadre of people?
Very few. He's an example. He's an example. Steve's an example. I brought all the people.
we have, no, I would say we have people in psychoanalytic training.
I thought you found the best. You just found all of them.
There are also neuroscientists. Some people from your lab have come from psychoanalytic training.
True.
We have imagers as well. And so there is
There is a beginning.
There is the beginnings of it.
But
I think that you said something very before I want to pick up on, which is you formed a hypothesis. As been said about psychoanalysts, they are great in terms of hypothesis formation, maybe the best, because they take all kinds of material, their conscious experience, the patient's unconscious experience, etc. They're great at hypothesis formation, but they don't yet understand the step of hypothesis testing. And that's the difference between simply perpetuating an idea and becoming a scientific investigation like Dr. Beck did.
I mean, which is why there have been there's hundreds of psychoanalytic theories. So it's very difficult.
That's not a problem.
We have many theories. We have we have an embarrassment of riches.
Right. Good. Just give an example of what you're talking about, a
Psychoanalytic theory. I mean, so we have people who emphasize the importance of the first year of life in development, or people who emphasize the importance of the third year of life. We have theories that concern themselves particularly with aggression, theories that concern themselves particularly with their sexuality, concern themselves with cognition, people concerned. What the problem is that eliminating theories has been difficult. Falsification has been a real challenge for us.
To be able to say that theory is false.
Wrong.
Yeah,
and that's the power of science.
Well, it's very hard.
The resistance to that is simply because the fear that it'll mean that my life is not.
I think there are two things. One is it's a union argument, you know, I may be out of a job. And the second argument is they're not competent to do it. They are scientific in their aspirations. They're not scientific in their competence to carry out experiments to test this. And I think part of the solution will come, number one, from more analytically oriented people being trained in science full-time.
Well, that's you.
Yeah.
No, I mean, come on, Eric. I mean, that's exactly what you did, right?
Fine.
No.
And people who are not analysts being interested in these problems. I mean, cognitive psychology. These are testing these ideas. You don't have to be an analyst to test analytic ideas.
When we talk about where this resistance is, we're talking about people who have an MD.
Or PhD.
Or PhD, and in many cases a residency in psychiatry.
That's right.
Yeah.
Yes.
I mean, this is not something you learn overnight just to get to the analytical phase.
That's absolutely true. But the fact is, going to medical school, taking a residency, and becoming an analyst doesn't in any way qualify you to do science.
And certainly neuroscience.
Any science.
Okay,
You're learning how to take care of people. You learn something about science, but you don't learn how to carry out experiments.
So let me just, before I leave this idea, so what would you do to those people, in a sense, to have them learn the science, or B, appreciate how to apply the science?
Right.
Is that right?
Exactly. You need any medical profession has a cadre of professionals,
investigators.
Who are full-time investigators who are charged with advancing the profession.
Right.
That, I think, has been missing in psychoanalysis. You know, or at least hasn't been as prominent in psychoanalysis and other specialisms in medicine.
Right.
And I think that is what's changing. There's a much greater recognition of the need for people to advance the science and do nothing else.
Right. Let me go. We won't have much time left here, and I just want to go. One, do we need to tie up anything that we have been talking about here?
I think just one slight elaboration. Analysts are trained in analytic institutes, which are throughout the world. And these are really training places for clinicians. That institute basis needs to be changed. It needs to devote 30% of its function to research.
All right.
You need to have a restructuring of the training of psychoanalysts to get there.
How has science, the neuroscience, change the way you approach these things? And not in terms of how you develop cognitive therapy, but in terms of what you...
Well...
How is science, and things that we can see and measure and calibrate?
I've tried to study the kinds of things that Eric has been writing about and so on, but so far we haven't been able to bridge the gap where it's actually going to change the way that I treat the patients. But hopefully, as we said before, we'll be able to determine there are certain areas of the brain that become inhibited or that light up when you use a certain particular type of maneuver. Right. And when we do all this neuroimaging, we'll be able to find out more. As it happens, there have been only a couple of studies where there have been neuroimages taken during psychotherapy. One of them actually was using just straight cognitive therapy with people who were depressed. As we said before, compared to pharmacotherapy, the cognitive therapy started at the top and worked its way down, and the pharmacotherapy started subcortically and worked its way up. And there's something about that that we could learn more about, which I haven't been able to integrate as yet.
Same question.
I think one of the things we have to recognize is that there's going to be no blockbuster study. Right. Often people complain about studies because, well, it was too simple, or it didn't address this, or it didn't address that. Eric's work has been a number of progressive studies over years. What we have to have is a dedication to doing systematic studies, each that address a small component, build a mosaic, as we were talking about, of knowledge that can really change things. And there has to be the patience for that, and the patience and the support for that. So we're not going to change and turn this ship around all at once, but that's the process by which knowledge is really gained.
I'd like to give one example, just one very simple and short example. One of the things I've learned from cognitive neuroscience is the importance of representing mental states, beliefs, thoughts, feelings, wishes, desires. Yeah. Neuroscience has taught us that there's a special part of the brain that actually in human beings is devoted to this capacity. We also know that when somebody had very adverse experiences in childhood, when they had terrible maltreatment from adults, they can decouple that capacity. I interviewed one young man. I asked him a question, simply, why do you think your parents behaved towards you as they did? He said to me, you tell me, you're the effing psychologist, which was, I didn't think, a very reflective statement at the time. But you know, what happened to him was that his father, who was an alcoholic, used to urinate on him and his sister when he was an 8-year-old boy. Now, if you're trying to put yourself into the shoes of that 8-year-old child, trying to figure out what's happening in an adult's mind that would make them want to do that, you can understand why he actually stopped wanting to think about why people thought, why people felt. I interviewed him in prison, because what he did was to grab ladies' handbags and bash them on the head, not really being able to think about what those ladies felt about those experiences. Now, the understanding that there is this capacity and that I can go in as a psychotherapist and try and enhance that capacity for that young man actually gives me an avenue, gives me a way in to working with him, which I didn't have before. So that's why I think the marriage, I'm not saying that the marriage is there, but at least there's an engagement. Or maybe we are dating.
Yeah. I think that's a very nice way to put it. I think that's absolutely right.
That science and analysis are dating.
Yes, they're beginning to get together, and they're beginning to realize that there may be a future relationship there. Certainly neuroscientists feel that in order to understand the human mind, they need to have a sophisticated approach to it, outline, and there's nothing like a clinical experience to give that to you. And we're also beginning, our understanding of the neurobiology of these complex processes are very limited, but two examples. One is we know that in terms of this internal representation, the anatomical changes that occur in the brain when one forms a long-term memory, those anatomical changes are much more profound early in development. For example, people have done imaging of string instrument players to see what the representation of the left hand and the right hand is in the brains of people who play the violin, for example. And it turns out that the right hand representation with just fiddles is no different than people who don't play an instrument. But the left hand, which does the fingering, has a much larger representation in people who play an instrument than in people who don't. And if you start to play an instrument before puberty, that representation is much larger than if you start later on. So the ability to develop an internal representation and stabilize it is much greater early in life. And we can understand how these childhood experiences might have a profound impact later on because they've already altered the structure of your brain, number one. Number two, a trusting relationship, including bonding in early mother-child interactions, involves imitation, empathy. We're now beginning to get a neurobiological understanding of it. There is an Italian group built around Giuseppe Visolati that has described these mirror neurons. These are neurons that fire in the brain of a monkey when it picks up a morsel of food. Now it turns out that those same neurons fire when he picks up a morsel of food. The animal pays attention to somebody else doing it. And we now have reason to believe, not only in monkeys, but in people, that whenever somebody else carries out an act, there is an imitative component going on in our head. So you can see how children learn from interaction with their parents. And your idea of this repetitive pattern from generation to generation is really an epigenetic reflection of this. It's an extremely interesting example. So you can see how these disciplines feed off each other and what a tremendous gain could come out of bringing the two of them together even more forcefully.
Exciting
to show you
times.
the dating, there is, in the Journal of the American Psychoanalytic Association, that very Italian group has described the mirror neurons, written in conjunction with the analytic group to describe what its relationship may have to empathy. So there's the perfect example of it.
How long will it take? A very long time.
That was my question.
A very long time. Really, I mean, I don't want to mislead. We as a scientist don't want to mislead people into thinking this is. It's a little bit like drug development. As soon as somebody finds a new way of treating cancer, people say, "How long will it take?" The answer usually is 5 to 10 years. Well, here the answer is much longer. This is the most difficult problem in all of science. Understanding the biological base of the human mind is the most complex task any area of science is facing. It's immense.
Thank you.
And you've got to give us time.
Thank you very
much.
Thank you. Thank you. You've done a great service to helping us bring people to this table, and I thank you for helping us. Thank you, Peter. Great to meet you. Stephen, my pleasure to meet you. Aaron, thank you so much for coming here this evening. And we thank you. He said it better than anybody could ever say it. Understanding the nature of the mind is one of the great, great, great journeys that science is taking. And if we can just give you some sense of the excitement and the questions, we have achieved what I hope to do in this 1 hour. Thank you very much. See you next time.